Good morning, everyone. Welcome to the Rock County Public Health Department media briefing. This briefing is streamed live on the Rock County Public Health Department Facebook page. And after the event, the recordings are available on our Facebook page and our YouTube channel. So today, we start with comments from the Rock County Public Health Department, and then we open it up to the media in attendance for questions. My name is Jessica Turner. I'm the communications specialist for the Rock County Public Health Department. And I have with me Nick Zupan, epidemiologist, Seth Longcar, administrative services supervisor, and Michael Niles, public health strategist. So first, as always, I'm going to turn it over to Nick for some data updates.
All right, thanks, Jessica. So in terms of our confirmed cases, we're up to 19,775 total Rock County residents have tested positive over the course of the pandemic. Currently, we're averaging 32 new cases per day over the last week. So we're seeing a slight increase since last week, but we are seeing a decrease in the number of active cases in our community. So more people are recovering from their illness than are testing positive. We have about 630 of those active cases. There have been 217 deaths due to COVID-19, and the most recent numbers of hospitalized patients is 12, so we are seeing a decrease in our hospitalizations as well. As of today, there have been 56.8% of the Rock County population having received at least one dose of the COVID-19 vaccine, and over 54% have completed the vaccine series. We are currently awaiting additional data on the number of booster shots that have been provided to Rock County residents, and when we have that data available, we'll make that public. Otherwise, that's really all the data that I have to provide for this morning's call.
Thank you, Nick. Next, we'll go to Michael for some information about booster doses.
Hi, everyone. So with so much in the news about COVID-19 booster vaccines, we want to share the latest recommendations from the CDC and Wisconsin Department of Health and Human Services. So on Friday, October 22nd, the CDC recommended that certain populations who have an increased risk of exposure to COVID-19, increased risk of transmission of COVID-19, or who are at risk for severe disease receive a booster shot of the Moderna COVID-19 vaccine at least 6 months after having received their second dose. So this is very similar to the previously announced recommendation for the Pfizer vaccine. The CDC also recommended that individuals age 18 and older who received the J&J vaccine receive a booster dose at least 2 months after their primary dose. So the Wisconsin Department of Health Services and Rock County Public Health Department both support this decision and encourage individuals who are eligible to get a booster dose. The CDC also recommended that healthcare professionals be allowed to provide a different COVID-19 vaccine as a booster vaccine than the one initially received, providing flexibility to healthcare providers and additional options for individuals. This mix and match recommendation for booster shots applies to all 3 COVID-19 vaccines currently available in the US. So specifically for Moderna and Pfizer COVID-19 booster recommendations, the populations recommended to receive a Moderna or Pfizer booster dose at least 6 months after receiving their second dose include those who are 65 years and older, people ages 18 and older who are in long-term care, have underlying medical conditions, or who are at an increased risk of the COVID-19 exposure or transmission because of their job or institutional setting. For Johnson & Johnson, a J&J booster dose is recommended at least 2 months after receiving the first dose for everyone age 18 and older. The goal in all cases is to further strengthen immunity, which can wane over time. So when talking about booster doses, it's important to understand the difference between an additional dose and a booster dose, which can be a little confusing. So a booster dose both serves a different purpose than the additional dose recommended for certain immunocompromised people in early August. The additional doses are for people with certain medical conditions who are receiving certain treatments, leaving them moderately or severely immunocompromised, and who may not have built a strong enough immune response after their initial vaccine. In contrast, a booster dose refers to another dose of a vaccine that is given to someone who built enough protection after their initial vaccination, but then the protection decreased over time, also referred to as waning immunity. Evidence suggests that immunity is waning over time for some people who were initially well protected by the vaccine. For those people, a booster dose will strengthen and extend their protection against infection, serious illness, hospitalization, and death from COVID-19. While these are general guidelines, we encourage everyone to please consult their healthcare provider to discuss the risks and potential benefits of booster doses given their individual situation. We have also been receiving some questions we thought would be helpful to share. First, if someone is immunocompromised, how many doses should they get and when should they get those doses? For Pfizer or Moderna, a total of 4 doses are recommended. Those include the initial 2-dose series, an additional 3rd dose 28 days after the initial series, and then a booster dose 6 months after that 3rd dose. For Johnson & Johnson, a total of 2 doses are recommended, the initial vaccine dose and then a booster dose 2 months after that initial dose. The second question we've been getting a lot is asking if individuals need a booster dose to be considered fully vaccinated. The answer is no. So you'll still be considered fully vaccinated 2 weeks after completing that initial vaccine series, which is 1 dose for Johnson & Johnson or 2 doses for Pfizer and Moderna. The third and final question is, people are curious if they can get a different vaccine for their 2nd dose or additional dose. While mixing and matching vaccinations is just fine for booster shots, the vaccine you receive for the initial dose series and an additional dose for those who are immunocompromised should be all from the same manufacturer. Again, we encourage everyone to please consult their healthcare provider to discuss the risks and benefits of additional or booster doses. We also encourage everyone who is yet to be vaccinated to please do so. To explore Rock County options, visit rockcountyshot.com, and for transportation assistance, please call 211 to arrange a ride. And back to you, Jessica.
Thanks, Michael. We will now go to Seth. Seth has some additional updates for us, including some news on the 5 to 11-year-old authorization that's pending. Go ahead, Seth.
Great, thank you, Jessica. So today we wanted to provide an update on the progress towards a vaccine for 5 to 11-year-olds. Tuesday, a panel of independent advisors to the Food and Drug Administration recommended that the FDA issue an emergency use authorization for the Pfizer-BioNTech vaccine in children ages 5 to 11 years old. The vote was 17 in favor and 1 abstention. Pfizer provided data which indicates the vaccine is safe and 90.7% effective in preventing COVID-19 infections in this age group. Pfizer also said the vaccine effectively neutralized the Delta variant in young kids. The FDA typically goes along with the advice of its expert panels, though it isn't bound to do so. It will issue a decision within the next several days. If the FDA authorizes the vaccine for these younger children, which seems likely, another panel of experts advising the CDC would make its own recommendations and offer guidelines next week on its use among this age group. A dose of Pfizer for young children contains 1/3 the amount of active ingredient compared to the adult dose. Children would receive a 2nd dose 21 days or more after their first shot. So in short, the FDA authorization and CDC recommendation for 5 to 11-year-olds is anticipated to be finalized the first week of November, with vaccinations potentially beginning the week of November 8th. We will keep you posted as we learn more. We do also have a few upcoming vaccine and vaccine plus flu clinics to share as well. An Evansville School District COVID-19 vaccine clinic hosted by AMI will be held tomorrow, Friday, October 29th, from 12 p.m. to 5 p.m. at 340 Fair Street in Evansville. A Parkview Elementary School District COVID-19 plus flu vaccine clinic hosted by AMI and the Rock County Public Health Department will be held Friday, November 5th from 12:30 p.m. to 4 p.m. at Parkview Elementary School at 106 West Church Street in Orfordville. The clinics are free, open to the public, and walk-ins are welcome. No pre-registration is required. At the clinics, COVID-19 vaccines will be available to those ages 12 and older, including adults, while flu vaccines will be available for children ages and teens ages 6 months to 18 years old. We are not able to administer adult flu vaccines at these clinics. Minors will need parental consent and should be accompanied by a parent or guardian. If a parent or guardian is not able to attend, they should call our COVID line at 608-352-6727 to discuss options. To register and learn more, please visit rockcountyshot.com or vaccines.gov. To arrange a ride, please call 211 or you can call 608-352-6727. We continue to strongly encourage everyone to get their COVID-19 and flu vaccines administered together or separately to help us continue to reduce infection rates and related hospitalizations. That is all for my updates at this time. Back to you, Jessica.
Thank you, Seth. And I actually just have one additional announcement before we open it up for questions. So, anticipation of the authorization of the Pfizer vaccine for the 5 to 11-year-olds, AMI will be adding additional clinic hours on Saturday, November 13th and Saturday, November 20th at their 1900 Center Avenue location in Janesville. Some of you may know this location as the former Rock County Job Center. They'll be open both of those days from 11 to 3. Again, that was November 13th and November 20th. Pre-registration will be available soon at vaccinate.wi.gov, and walk-ins are always welcome. This is in addition to their regular hours. They're open every week on Tuesdays from 11 to 5 and Thursdays from 11 to 3. So now we will go ahead and open it up to questions. It looks like we have one participant today. We have Austin Montgomery from the Beloit Daily News. Thanks for joining us today, Austin. We will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Thanks, Jessica. I just have one follow-up question. I was trying to track when it was mentioned just the timeline for immunocompromised people to receive doses. Just wanted to get that information again, but other than that, I don't have any questions. Thank you.
I can take that, Jessica. Yeah, so let me just pull them up really quick because the guidelines are a little confusing. So for immunocompromised people, so for Pfizer and Moderna, the recommendations are exactly the same. So a total of 4 recommended doses total. So the initial 2-dose series, and then an additional dose 28 days after that initial 2-dose series, and then a booster dose 6 months after the 3rd dose. And then for Johnson & Johnson, a total of 2 doses are still recommended for all immunocompromised individuals. And that includes the initial vaccine dose and then a booster dose 2 months after that initial dose.
Thank you so much. Just checking one more time, Austin, did you have any additional questions?
Nope, no other questions. Thanks.
Great. Thank you, Austin. And thank you for participating today. And I want to thank everybody who's been watching us on our Facebook page and anyone who will be watching us on the recordings on our Facebook or our YouTube channel. So this will conclude today's media briefing. Again, we have these briefings every other Thursday at 11 o'clock. They are live streamed on our Facebook page, and recordings are available on our Facebook page and our YouTube channel. So thank you very much, everyone. We will see you in a couple weeks. Stay safe and stay healthy.